Hello everyone, it's Pharmacist Chika again, and this time around I am coming with a very important information concerning the epidemic or the pandemic. I won't call it a pandemic, more like an epidemic that has just, an outbreak that has just been recorded in the recent days in Africa, including Nigeria. Nigeria is one of the countries that have been recorded to have some cases of cholera, and it's increasing. The infected cases are increasing. Now I'm going to be dropping a few tips about cholera you really need to know. Very important tips. Oh yes, as usual, I'll be coming with them. Stay tuned. So cholera, as you know it, is a disease. It's an intestinal disease. It means that it infects the intestine, right? And it's caused by a bacteria called the bacterium Vibrio cholerae. That's like the botanical name for it or the scientific name for it. So it's from a family of what we call the Vibrionaceae. Vibrionaceae is the family name for cholera. They are a water dependent kind of bacteria, meaning they're easily found in water. They live in water. So if they are found in water, if a water is infected with an organism like cholera, it can easily be found in anything that water is used for, right? Yeah. So what are the symptoms? We normally find a cholera infected person or a case usually with symptoms like vomiting, frequent diarrhea, like an intense case of diarrhea where the person stools an enormous amount of water, losing water. So now the patient's state is will begin to manifest what we call a large amount of water loss or body fluid loss, including salts, which we call dehydration. Yes, dehydration. I think you should also note that cholera, in the case of cholera, in the time past where there have been pandemics, there have been safe, effective, and inexpensive interventions that have been put in place over the years. And I think I'll go through a few of those interventions so we can take note of them and how we can prevent this cholera pandemic from happening to us or happening to any of our loved ones by sharing this video. So I'm going to share a few of the tips on how to prevent this. Very, very simple tips on how to prevent this. It's really nothing too much. And even when there's a likely case of cholera, we'll also discuss, I'll also drop a few things that can be done easily to revive that person where the case does not extend or deteriorate to death or a critical case where the person has to be admitted. So I would like to describe a little bit about this, our enemy that has just popped up in this season of our lifetime, right? So they've actually been recorded cases of the cholera epidemic in the past, but this is another one that has just started now, and we need to know this about cholera. Cholera is water dependent or water dwelling, so it's found in water. It's also said that it's aquatic, so it lives in water. So you also there's something else again we know about cholera is that it looks like rod shape, but when it's isolated, it's curved in nature. So when you see it under the microscope, you know that if it's isolated out of water, it's curved, but when it's in the midst of others, it's rod shaped. That means it looks like a rod under the microscope, right? And then it's a gram-negative pathogenic organism. It's gram-negative. Gram-negative, as health professionals will understand that we have bacterial forms we call gram-positive or gram-negative. So when you're about to treat it, you can only treat it with antibiotics that are sensitive to the gram-negative, like antibiotics that can actually destroy or kill the growth or the spread of gram-negative pathogenic organisms. So yes, this cholera is extremely wicked. You won't believe that this cholera has 200 different forms. Like it has, when you have different forms, like an organism can have in its form different forms, and it's identified by the kind of protein found in its body, right? But thankfully, it's just 2 of these forms that have actually been linked to the pandemic or epidemic in the past. These 2 forms that we know the serogroups that we know are the O1, the cholera O1 and the cholera O139. Now, those are the two that have been linked to the epidemic in the past, right? But these serogroups also have what we call biotypes. The biotypes that have been majorly linked to the epidemic in the past are the ones we call the classical and then the L-TOR. There are two major biotypes of these organisms that are linked to the epidemic in the past. The two major biotypes also have what we call serotypes. So now you have biotypes and then you have the serotypes that you are narrowing down to the exact organism of this cholera that are actually infectious and are easily spread or transmitted. So now types, we have the classical and the L-TOR, right? We have the classical and the under the biotypes, we have the classical and the L-TOR. So we have the serogroups that are the O1 and the O139 as the serogroups that are infectious or more like cause the epidemic. And in the serogroups, we have biotypes. The biotype is the classical biotype and the L-TOR, right? Now, these two biotypes also do have three known serotypes. They have three known serotypes, which are the Ogawa, the Inaba, and the one that is not commonly known is the Hikojama. So these are the three serotypes that we know, right? The biotypes that are classical and L-TOR also have serotypes, the Inaba, the Ogawa, and the Hikojama. So if a patient is infected, they usually test for the commonly found protein in Inaba, Ogawa, or Hikojama. So an infected person can have the two or have one of the strains. So when they find the detector, like the rapid testing that is done, is just going to detect the particular protein found in any of these organisms. So when they identify, they will now know which of the infectious strain is the patient infected by. So when the test is done, you can easily know if the test is caused by one of the classical strains or one of the L-TOR strains. So it makes it easy for the health professional to actually administer treatment or move forward to other if there are other underlying expressions of the sickness, or if there's any strange one, so it can be reported and recorded, and further medical or health interventions is carried out. Yes. So you should know, one, that cholera is waterborne, so it's found in water, right? It's transmitted by what we call oral fecal routes. So that means it gets it is caused by when an infected excreta of an infected human gets in touch with either water, contaminates the water used by another human. So it's easily spread by excreta, right? Excreta from an infected person, which is obviously infected, and that excreta probably gets in touch with water used to either do something that gets into the human system through the mouth. So it moves from fecal, which is poo, to oral, which is mouth. So it's transmitted by oral. Yeah. So like I said, one of the most common ways one can actually get infected is either when an infected person's poo gets in touch with water. Now that water is infected and is used to either wash, irrigate food that is not cooked, maybe like fruits, vegetables, and is ingested directly into the mouth. Another way is if a poo from an infected person is used to even plants. It can even use for planting. So it gets in touch with maybe like carrots that are roots, fruits, or vegetables that are not cooked, right? Especially when these meals are not cooked, they get into the system and can be ingested easily and can actually infect a human body easily. So we should take note of the forms with which these cholera can actually get into the system. Now, one of the things that we should also take note, shouldn't scare us, but we can take adequate preventions on is trying to protect ourselves, our food, the things that go into our system, protecting our food and how it gets into our system, right? You protect it from being contaminated, and taking the precautions, even when you can't even protect it from being contaminated, the precautions we must take by keeping this, even if it's contaminated, the things we can do to make sure what we are taking in is not contaminated, or even though contaminated, we are prevented from actually getting infected by this cholera. Important to take note that these strains, the classical strain was once identified as the cause of the past epidemic, but recently the L-Tor biotype, which is harder, is more difficult to treat, and then it lives longer. The lifespan of it is longer, so it lasts longer in water. And once it lasts longer, when it gets into the intestine, it has a way of getting us sick even for a longer period. So we need to take note of this. What really happens when we eat food that is infected with cholera, Vibrio cholera? What really happens? The Vibrio cholera gets into our system and goes straight to the small intestine. It goes straight to the small intestine. It secretes what we call a toxin, an endotoxin that goes in and binds to a receptor in the small intestinal wall. Now, that receptor it binds to is supposed to be in control of what we call the water electrolytes pump. There's a water electrolyte pump at the cellular level that receptor controls. So when the toxin goes to bind to that receptor, it leaves it on an automated on. So imagine when you come into your room and your light is constantly turned on, and there's nothing you can do about it to switch off. You can imagine the dangers that are accrued to a situation like that. So now when it's constantly turned on, the body system loses its ability to retain fluids or electrolytes, and then the person begins to stool enormously, a lot of amount of water and fluids and salt and nutrients, right? If there's a nutritive condition previously, it gets worse. So in this case, the person loses water as much as 1 liter hourly. An amount of water as 1 liter hourly for a child is extremely dangerous. It can go as bad as even leaving the child malnourished, extremely dehydrated, muscle, you can start having lethargy, pains in the muscles, dehydration, general body weaknesses, body pains, and it could even lead severely to what we call seizures. There could be seizures. Now, when it starts affecting the brain, there could be fever in children cases, febrile cases. In kids cases, it could end up getting to fever, and then seizures, and then possible death. In a case where the immune system is already low previously, or there's an underlying illness, it can end up in death. Like 50% of cases untreated can end up in death. Now we'll be discussing how we can handle cases of cholera. Please, I think we should also take note of the foods that are frequently or easily contaminated by cholera. Foods that are not cooked. Our vegetables, our fruits, our seafoods that are not cooked, carrots, vegetables, all those things we just wash with water. Washing with water now is not just enough. Chlorinated water, like using salt to wash our water, would really go a long way in helping, right? Because once we have our water salted, it's kind of it's a form of chlorine, right? So it chlorinates our water and keeps our water free from any germs or pathogenic organism. So it's important that we use chlorinated water to wash these things if we can't even cook. But ideally, we need to cook all our food in these times that there's an epidemic of this, or an endemic of this cholera. We need to cook all our meals that we are eating now. Try and parboil at least to 70 degrees centigrade is essential now to prevent these foods from getting infected. Our foods. Now we need to take another method that have been used widespread is the method for rapid testing. So there have been rapid testing can be done locally. The government can chair that, or the primary healthcare can actually chair that, where rapid testing is done in locations where we have water supply, right? We have our local supplies to the various areas and various residential areas or neighborhoods, and water is tested to know if it's actually there's an infection there. So like I said, the protein strains in this cholera can be tested to know what is in there, right? Is there cholera there? And if it's there, which of it is there? Is it the infectious one or the ones that can just be passed through without any infection? But whichever one that is there, the water should be preserved. The water should be preserved. We should also take note that if we're going to preserve food in this time, all foods must be covered. Your pots must be covered. Plates served with food should be covered, because we know that there are some rodents or some insects or household insects like housefly can actually carry out this. There are many things, people that can carry this, many insects and animals that can carry this or transmit this from one place to the other just by moving, so we need to have our food always covered. Very important. And we have leftovers. If we have leftovers, please, I advise kindly to boil. Try and warm up your leftovers, heat them up to at least 70 degrees centigrade, please, so at least 70 degrees centigrade, and try to eat while hot. Eating hot food now is well encouraged, because at that point you can ascertain that the cholera or whatever infection, contamination can't be found in that meal at the time when it's being eaten. When it's hot, it can't be there, but when it's cooled, you don't know if it's been reinfected of some sort. So please, I beg you, it's important your meals are warmed in this season. Our food vendors, please take note. Our food vendors, is important now that we take all the necessary precautions. Please, my people out there, be very careful. If you patronize food vendors, it's time to now check yourself very well and find out if it's very important to actually patronize food vendors. Now, it's not encouraged at this time to continue patronizing food vendors, because we are not sure of how much hygiene is being upheld at the times when they produce this food. So please, by all means, we are trying to, I'll tell you and I'll admonish you to please watch out for the food and where you buy your food from. The food while you're at work, while you're in church, wherever you are. If you've traveled for an official trip or something, watch out for where you get your food from. It's very, 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 very important. It's important to keep your water clean. So one of the preventions we're going to take on is safe water for use. Any water you use right now at home should be safe. Your water supply should be safe. You can get them chlorinated, for local governments can have a chlorine given out to households to help them, chlorinate as much water as possible in these times. So any water used at home are all chlorinated and free from cholera. So then boiling water can actually help in places or areas where they can afford boiling water. We all know how much it takes to boil water now with the gas or with any form of energy. It's a little expensive, but if that still cannot be afforded, I think preserving water in covered reservoirs or covered containers can actually be encouraged now, and even the government can actually help in disbursing these materials to households around in local government areas and all, where people can't afford these huge reservoirs that have covers. It's very essential that most of our water reservoirs are all covered and they have a very little opening that can be used to have the water run out easily and be dispensed for use. Vaccines. Have vaccines actually helped in cholera? Well, the publications actually say no. They only help out with travelers going to the endemic areas, and it's just for a short period of time. So they've not been any record of any, huge, intervention or prevention in the sense of that, like stopping the widespread of cholera by vaccination, right? It's a short-term period of vaccination, so it only helps travelers that are going towards the end or the areas where the epidemic have occurred. So we need to take note. It's better to prevent this from happening by taking all the necessary precautions from having our food or whatever thing we take into our system not infected by cholera, and anyone around us is safe. So in the case of cholera, you will definitely see diarrhea. When that endotoxin has bound to the receptor site in the small intestine, the patient would continue to stool, to vomit, lose fluids, and there will be massive loss of body fluids and salts. So in that case, you may see cases of, like I said previously, there will be general body weaknesses, muscle cramps, because the muscles that need fluids and salts and electrolytes have lost most of it through the vomiting and stooling that's been happening probably hourly. and then eyes become hollow. You know, when you lose a lot of fluids, the eyes start to sink in, and there's some other severe cases where the BP will drop, and then the pulse become faint. You know, these cases are very, very deadly. They are very deadly. They can actually leave even an older person, lose his life in that case. So generally, how we handle these cases is to restore, or what we call rehydrate. So in the therapy of rehydration, it can either be done orally or through IV fluid, depending on how severe it is. So in some cases, we do orally. Some patients do orally and they're fine, where ORS, a combination of sodium salts and some other salts, are combined. They are sold in pharmacy stores where we have oral rehydration therapy. They are powdered form, then dissolved in a good amount of water and drank over 24 hours or 48 or 72 hours, depending on how severe it is. But then in some cases where an IV fluid needs to be invested in this patient, they are administered appropriately, checking the electrolytes that have been lost over the hours that this patient have stood through the period. So appropriate and adequate infusions, IV infusions or IV fluids are administered by the health professional, or they are taken to a clinic close by and they are rehydrated through this method. Now, there are some cases where these methods will not work. They may have to administer an antibiotic. So some antibiotics have been listed as commonly used. There are a lot of them that are used for gram-negative bacterium. But tetracycline is a very good one, even though it's not usually found anywhere. But the broad spectrum, generally as a pharmacist, I'll recommend any broad spectrum antibiotic that can go through gram-positive and gram-negative will take out cholera one hand. So just try and do a broad spectrum antibiotic. If you don't find tetracycline around you, a broad spectrum antibiotic can be taken for at least 5 days, and go ahead with the normal dosing that has been recommended, and you'll be fine. To say that you're not going to travel to those areas because there's cholera really have not had any record so far. There've not been any record so far that because you did not travel to that place, you did not get infected. No, because somebody that traveled out of that place can actually get to you and still get you infected. So restrictions to travel have not really helped, or restrictions of importation or bringing in food from those areas have not helped really. So I think the government should take note that restricting the movement of food from areas that have infected cases will not really change anything. We just need to take the appropriate measures by preventing our food, protecting our food, and having constant, sustained safety in our water, hygiene of our water, making sure that hygiene after defecation is maintained, where after poo, we wash our hands. Before you eat, you wash your hands, and after. So these are the things that before poo and after poo, we wash our hands. Very important. So these are the hygiene procedures that should be upheld in every institution, in schools, at workplaces, in church. Very, very important. These things are upheld. These procedures are upheld. There are high hygiene procedures in the cases of epidemic that can be easily transmitted through the oral mouth. So we don't know what to make you have a touch with someone or something, or someone that has used a toilet recently that has not washed, and then you have a handshake, and then for some reason you're using that same hand to eat something in your mouth, you can get infected. So at this time is when we admonish everyone to uphold a very high level of hygiene. You can have your hand sanitized by your side all the time. It would also help to keep your hands as clean as possible, and then you help your kids. Since it's more fatal in the cases of children, please, I advise that our children are kept away. Their hands are constantly clean. You can carry around a hand sanitizer, a pocket-sized hand sanitizer around in their bags. And then if they're in school, school management should also uphold the high hand hygiene at the levels they can, with buckets filled with water, where children wash their hands before eating and wash their hands immediately after defecating or using the restroom. So please, this is Pharmacist Chika encouraging everyone, you don't have to be scared of cholera, right? Take the necessary precautions, and I assure you, you will be fine. I assure you, you will be fine. Thank you for watching this video to the end. I know it's not easy, but at least you're taking note of some things or some information that you needed to know about cholera. Thank you very much, and God bless you.